name is Jolyon Mullet. I work for UNICEF as a WASH manager. UNICEF decided to support the MHHM Summit because this is a key forum for all stakeholders working on MHHM to come together, discuss the key barriers faced by women and girls who are menstruating, and come up with what I hope are actionable solutions to help address some of these barriers. We're very excited because MHHM cuts across multiple sectors, including water, sanitation and hygiene, sexual and reproductive health and rights, education, among others. And this is something that UNICEF feels very strongly passionate about to make sure that girls and women reach their full potential.
My name is Anne Dürkling and I'm the Vice President of AWA Nigeria. The summit is a great way to create a platform that is intersectoral, that really brings everyone together, where we can talk about national policies, how we can move forward the access in public buildings and schools and also in the communities. We all have similar approach to how we actually train and sensitize girls also on menstrual health and hygiene management, so that we actually can compare outcome. We're all doing something and we're all active, but we don't really work together to have measurable results at the end of the day. And that's very important for us to actually, achieve progress in the country.
After this summit, I want issues around the menstruation to be normalized. There should be no shame about any girl or woman menstruating. We hope to dismantle all the taboos. We need to make corrections about the myths around the menstruation and make it just a normal discussion. My joy is that all the partners from MDAs, from donors, from IPs, from CSOs, from all our stakeholders, they are at this summit, and that goes to show that we are already working towards one goal, and the goal is to ensure that issues of discussion around menstruation becomes normalized in Nigeria.
I'm hoping to see that this is juxtaposed and it affects every sector of the economy. For menstruation as a woman, it affects education, it affects trade. That is the sector we are in. Women traders, it affects a whole lot. So I'm hoping to see that this is more pronounced, to create more awareness that it's normal for women to have their periods every month, and to create a safe place for people to air their views, talk about their period pains, and ensure that even the people who cannot afford it, it's provided for them.
What I hope to see as a long-term impact of this event is that I want us to go beyond words. Let's begin to put words into action. Let's begin to take tangible actions that will support girls in school, keep girls in school, make sure they progress through school. We want them to be able to learn. We want them to be able to lead, decide, and thrive in all aspects of their lives. As the mandate of Plan International states, we want to empower girls to drive change and take action in every aspect of their lives.
My name is Aisha Adebe. I work with MSI Nigeria Reproductive Choices. The reason why MSI decided to support this summit is MSI is rooted in reproductive health. That is our core. We can all contribute to creating a period-friendly world by being intentional. Intentional in seeking out information that can help the young persons just starting to see their menstrual cycle. We can do that by getting involved in things like this, the Menstrual Health Summit, where there are policies that need to be developed. We also need to contribute.
The theme for the Menstrual Health Hygiene Management Summit 2025 is about empowering lives, breaking barriers, and building dignity. We came up with this theme because for us to achieve our aim, first of all, we must empower people with the right knowledge to know their rights from their wrongs, because it's easy to assume that people know what to do or what not to do, but we have to create a platform where young women and girls feel safe enough to learn, and that's why empowering life is one of our first sentence in our team. And then we now have breaking barriers. There are so many stigma, mindsets, culture that we need to learn and unlearn for menstrual hygiene to thrive in Nigeria as a country. We want people to see our story, hear our story, feel our story, and carry out actions in line with what it is we want to achieve at the summit by creating a safe space for young women and girls who have to menstruate every month.
What I'm hoping to see as the long-term impact of this event is providing more digital solutions. Obviously, this is an amazing summit that we've gathered here to be at today, and one of the reasons why we have these kind of things is to be able to have conversations as to do more work and what we can do in order to, you know, promote our message forward. What I'm looking forward to the most is how we can push our efforts and triple our efforts using digital platforms so that every woman in Nigeria and men as well are, you know, preaching the word and the gospel of women's health and menstrual health.
Empowering lives, driving change and breaking barriers pretty much just means creating platforms and opportunities where women and girls, especially those in underserved, marginalized communities and rural areas, have an opportunity to be heard, that we create opportunities for them to tell their stories themselves or even act as representatives of these people, knowing that a lot of us have lived experiences or lived realities from what, you know, these women and girls go through, especially when it comes around the issues of period poverty, menstrual health and hygiene conversations, right? And the barriers would pretty much be that we create opportunities whereby there's no discrimination or stigma around period, that we don't hush conversations around menstruation because it's a completely normal part of being a woman, and there's no reason why anyone should be stigmatized or made to feel less because of their periods.
This is a conversation that has been brewing and now is boiling out of the pot. We have needed to have these conversations to gain traction, and it is finally doing so. There are so many underserved, marginalized communities, and I always like to say that a solution that will last must be indigenous. You know, if it isn't indigenous, it will not work and it will not last. It may work for a while, but it will crash. And so it's good to see that on a day like this, indigenous NGOs are here doing the work that is critical and vital.
We all can be menstrual health advocates, and what I mean is that we need to open up, speak up, and contribute to positive, normal conversations about menstruation. This helps to address all the myths and false beliefs around menstruation. It helps to address stigmatization, because the issue of period poverty is really centered around stigmatization, stigma, where girls and women, you know, cannot open up, cannot speak up, even when girls need help in terms of maybe they are going through menstrual pain, they need support. Girls do not speak up. So speaking up is the basis. Each and every one of us needs to get to that level where we speak about menstruation.